Hi everybody, today we're talking about ADHD. In May of 2013, the DSM-V was released, and the DSM-V is essentially the book that is used by psychiatrists and psychologists in order to come up with specific diagnoses, things like ADHD, autism, depression, anxiety. In this book is listed the symptoms that are associated with each of those conditions. So in May of 2013, they eliminated the term ADD and changed it to ADHD with 3 subtypes. ADHD with number 1 was inattention, number 2 is hyperactivity, and 3 is combined, which essentially means inattention with hyperactivity. So let's talk a little bit about girls versus boys. You've heard me talk before about how girls sometimes slip through the cracks. And this is because a lot of girls suffer more from the inattentive form of ADHD than they do the hyperactive. And if you think about a little boy who's in class, maybe disruptive and moving around, dropping his pencil, tapping his foot, that's very obvious symptoms that are destructive. But the little girl that might be looking out the window, just being inattentive, she might not really cause too much of a ruckus in class, that she might just not get the care that she needs. So it's really important, if you notice that your little girl has challenges with inattention, where you feel like you're having to redirect her, or she's not necessarily retaining the information that you're going over, she might indeed need some help. Preschoolers is also a common question I get. How do you know if a preschooler has a challenge? And this can be a little tricky because, of course, some of the hyperactive behaviors that are not appropriate when you're older are appropriate when you're a toddler, right? So you really want to bring your child to a professional who can help you determine whether this is neurotypical behavior or something that might require some attention. I will tell you that most parents that I work with notice that when their child has been diagnosed with ADHD, typically older, 7, 8, 9 years old, they tell me that they knew when their child was a preschooler that this could be a challenge. So if your gut's telling you something, definitely act on it. Here we do a QEEG, which is a brain map, and this is really important for people who are suffering with ADHD. ADHD has certain neurological brainwave dysregulation patterns that we're used to looking at. 85% of kids with ADHD, whether it be combined, inattentive, or hyperactive, have a very specific kind of brainwave dysregulation. If your child has this brainwave dysregulation and has ADHD, if there's a match in that, the neurofeedback therapy can be a viable way to address your concerns. If you'd like to learn more, feel free to check out our website, which is newlifechiropractic.com. Thanks so much for tuning in. Until next time. Bye.